Hi, my name is Victoria Zangrillo, and I am in Bio 4970 online, and my grant proposal topic will be on infertility related to cancer. And I am just going to go over some definitions that are important of what I will be speaking about today. So infertility is not being able to get pregnant after 1 or more years of unprotected sex. Cancer is a disease caused by an uncontrolled division of abnormal cells in a part of the body. And then some more important vocabulary words that you might hear me speaking about today is chemotherapy, which is a drug treatment that uses powerful chemicals to kill fast-growing cells in your body. Reproductive health, which is the condition of male and female reproductive systems during all life stages. And there will also be a couple different cancers I will be talking about. Breast cancer being one, which is a disease in which cells in the breast grow out of control. And there are different kinds of breast cancers, and that is all depending on what cells in the breast turn into cancer. And there is cervical cancer, which is a type of cancer that occurs in cells of the cervix, which is the lower part of the uterus that connects to the vagina. And then you have abdominal radical tracheotomy, which removes the cervix and nearby supporting tissue through a large incision in the abdomen. And then we have non-Hodgkin's lymphoma, which is a cancer that starts in the white blood cells called lymphocytes, which is part of the body's immune system. So my grant proposal topic is on infertility and cancer, and those are major problems in a lot of people's lives. As a whole, many do not understand the effects of cancer and cancer treatments on the body. One of these effects is infertility. Whether it be on males or females, it can happen to both. This review is intended to look at different types of cancer treatments that affect the body of the reproductive health, how babies are born to women who have had cancer, and the possible effects of having cancer as a young child and then trying to have children later in life. And all of these aspects can help men and women understand what options are available to them to have children later in life, or if they're struggling with cancer at the moment. And this is also better to educate young adults that are trying to have children and to even understand what reproductive health is as a whole. And so for my literature review, my first important research article that I found is on infertility among men and women in our society. Most do not understand the impact it could have on someone's life and or family. With infertility being so common, 190,394 of women's cycle took part in some kind of assisted reproductive technology. Hansen et al. 2017. Infertility can occur due to multiple different reasons. This study explores the association between infertility-related diagnoses, and certain diseases. Exploring this topic started with a search on Medline in 2016 that produced 425 studies. Hansen et al. 2017. After reviewing all articles, 26 were selected by the authors as acceptable. Infertility and mental health are very much related. 6 studies show that people who are infertile or have infertility-related diagnoses have increased chances to foster a mental health problem. There is no confirmed causation, but it is essential to realize the correlation. Consciousness of this could help clinicians understand the challenges women encounter with infertility. Hansen's et al. 2017. 9 studies assess prospective links between infertility and infertility drugs used with maturity of breast cancer. These findings were inconsistent. 7 studies showed no significant alteration or conflicting evidence between breast cancer and women being infertile. A few other studies show low risk and positive correlations between infertility and breast cancer. Hansen et al. 2017. The study also looked at the correlation between ovarian cancer and infertility. 1 study out of the 9 showed an increase in ovarian cancer due to infertility. The 8 other studies presented data that disputed if women who had infertility issues were at a higher risk for ovarian cancer. Assessing women with general infertility seems to generate diverging results. If broken down into subgroups, there could be an advantage from supplementary testing for ovarian cancer. Hansen et al. 2017. 5 studies assessed likely links between infertility and endometrial cancer. 4 of them showed certain subgroups of the population had a higher probability of cancer. 2 of them assessed reproductive therapy techniques related to endometrial cancer. Hansen et al. 2017. Now, the next article that I found was also talking about treatments now related to cancer. So infertility can occur not only from certain diseases, but can also come from treatments used to treat cancer. Many women are not aware of the effects that certain treatments have on their body. This study looks at young adults and the field of oncofertility, which is cancer of infertility, which has only a handful of evidence-based studies. Fori et al. 2019. There was an assessment on the existing position of oncofertility in Japan and examined some of the results from a significant national survey that the study presented. Fiore et al. 2019. Questionnaires were given to young adults doctors to be distributed to survivors from June 2016 to November 2016. Fiore et al. 2019. 100 healthy young adult females that signed up for the research took a questionnaire online. And then these young healthy females were split into 4 age groups with 25 people in each. Fiore et al. 2019. Out of them, 752 questionnaires were given out and 261 were gathered, even from men, which gives a response rate of 34.7%. Fiore et al. 2019. From the questionnaire, there were 10 major items discussed and consisted of 258 questions. Only questions related to young adult and infertility were gathered into the figure below into the study. 167 females responded, and 115 of them were no gynecologic cancer survivors and had received chemotherapy. Fiore et al. 2019. 20 survivors of cancer were diagnosed with infertility due from chemotherapy or radiotherapy. Each one wanted children but gave up, and this number of women was higher than those of the healthy young adult females. Fiore et al. 2019. A number of patients who are beginning survivors of cancer stated that they received information on infertility and potential reproductive dysfunction due to treatment. A smaller number of patients stated that they received information on infertility and potential reproductive dysfunction prior to treatment of the cancer. Fiore et al. 2019. Cancer can not only have an effect on infertility, but also on patients who become pregnant after having cancer. This study takes a look into subfertility and fertility treatments and the outcomes of each child born. So as discussed in this study, there has been a prior link to cancer treatment and the effect that it has on reproductive health. This study involved 630 deliveries in Massachusetts between July 2004 and December 2013. Farland et al. 2021. The data that was collected came from the MA Registry of Vital Records and Statistics, the Pregnancy to Early Life Longitudinal, the Society for Assisted Reproductive Technology Clinic Outcome Reporting System, and the MA Cancer Registry. Farland et al. 2021. The adverse outcomes from this data showed the deliveries, which could include low birth weight, small gestational, preterm birth, mortality, etc. Farland et al. 2021. A birth was characterized as subfertile if the birth was from fertility treatments, meaning like IVF or surrogacy. Farland et al. 2021. The pregnancy outcome risks were demonstrated using log Poisson regression. Out of all the deliveries, 2,983 had recorded of initial life cancer. Farland et al. 2021. The deliveries also are with an older maternal white woman. Looking at maternal morbidities, women with the history of cancer had a higher risk for gestational diabetes. Looking at birth, infants born to women with history of cancer did not have a greater risk of SGA, matched to women never diagnosed with cancer. Farland et al. 2021. And the infants born to women with a history of cancer were at a greater risk of low birth weight and preterm birth. Farland et al. 2021. The relationship between cancer and infertility can be determined by different cancer types, treatment options from cancer, and the outcomes from births from women who had cancer. And that is why a grant proposal on infertility and cancer and how they are so much related is very important to be studied and for young men and women to know more about. Thank you.